I wanted to talk about antidepressants, a little bit of an introduction to antidepressants as it's one of the most commonly class of medications that we use since antidepressants are the medications of choice for any anxiety disorders or depressive disorders. So antidepressants have many different classes, and there's a list, very long list of side effects that you're going to find in every single antidepressant. However, the most commonly seen, at least in my experience, are headache and nausea. Most of the time, these side effects will happen within the first 3 to 5 days, and most of the time, it goes away by the week. Now, I usually tell my patients, first of all, that, you know, first try to see a psychiatrist. Try to, as soon as either you're put on an antidepressant or just to start an antidepressant. Me personally, I like to start with the lowest ever doses possible in any type of medication, as most of the time we don't really know if a patient is sensitive or not to a medication. So when patients, nowadays we have for example, the gene site is what I use for checking the genes in your body that are being used by medications to metabolize. And we can see very clearly that each medications are metabolized through different genes. Each of those genes metabolize differently, as in slower, faster, ultra rapid, or normal. Depending on how you metabolize those medications is how you feel with the medication. So if you, because you have side effects with one medication in one class, doesn't mean you're going to have side effects with another medication in the same class. So, which is why it's important that, first of all, that you follow up with your doctor. Like I said, I personally start with the lowest dose possible, and I gradually go up on the medication as needed also. I don't go up to a specific number or dosage. I follow what the patient tells me, and if I see that there is no improvements in the patient's symptoms, then I would definitely go up on the medication, of course, as long as the patient agrees with such a change. I think it's very important that patients are actually more than even the doctor who decide what to do with the medication, as long as the doctor gives the patient the right amount or every type of information that they can have in regards to what's the benefit and the risks. Not only that, also the process. It is important for the patients to know what is the process with the medication. We start medication low dosages and we increase. We can decrease potentially every 2 weeks, sometimes with some patients, sometimes we need to wait a little bit longer. When a patient has a side effect, we have to change medications. Try another class, try the same class. There's so many differences, so it really depends from patient to patient. Because someone else had a side effect to medication doesn't mean you will have it. So you can't really compare yourself to anyone else that has ever been on medication, even though people tend to do so. But you really should not, because everyone is different. And the goal of the medications are not to make you feel numb or weird or a zombie. The goals of the medication are really to help control the symptoms that are currently active. And in order for that person to be able to deal with the true underlying causes that are bringing those symptoms up. So if I am anxious all the time and I'm having panic attacks every day and I'm doing therapy at the same time that I'm taking medication, it's going to be very hard for me to deal and process whatever's going on underneath the symptoms if I'm having a panic attack every 5 minutes. So we need to control the anxiety, we need to control those panic attacks from coming in order for a person to be able to allow themselves to open up, to be vulnerable, to feel, and really deal with the underlying reason that's causing the symptoms. So that's what the medication is supposed to do. Ideally is that you take a medication and you feel like you're not really taking a medication. And you have, of course, no side effects of the medication. Also, sometimes people say, I took a medication and then they just stopped it. In order to say that a medication, or it didn't work, in order to say that a medication does not work, there's two things. Either the medication was maximized to the maximum dose and you still had symptoms even by taking it, or you were increasing dosages and you had side effects from it. those are the only two reasons. Sometimes people stop, patients on medication without maximizing, or start switching, patients around. That really starts complicating things a little bit more when at least when, let's say, patients come to me after having seen other people. So, ask your doctor. Ask your doctor why the changes. Try to understand what's happening. Try to have the doctor explain why are they changing the dosages, why they're changing the medication, what to expect from it, how long would it be, would you possibly be on the medication. It's always hard to give a specific time because everyone is different, but that's why doing the therapy with the medication is so important, because the therapy is what's really going to help you get off the medication at some point. I mean, the goal should be to get off the medication, not to stay on the medication. The goal of the medication is to help push you a little bit faster in the beginning, to be more steady, and to be more than anything functional. The idea is for you to be able to have your life and be with your family, be with your friends, and be able to, enjoy it faster, while at the same time you're handling or dealing with the underlying issues. So, make sure you understand what you're taking, why you're taking it, and if there is any changes, why you're having changes. Not everyone is the same. Please remember that everyone is very different when it comes to medications, and make sure you get educated before you see a doctor or ask your doctor. Don't Google. There's many things, and you can't, like I said, there's many things said in the internet, and like I said before, everyone's different. So because someone else went through something doesn't mean you will. So I hope that this helps a little bit on antidepressants. I'll see you soon.